Dr. Tim Nickel with Maximize Chiropractic. Today I want to talk about the importance, if not arguably the necessity of taking x-rays for an appropriate chiropractic adjustment. The x-ray you see right here is a normal healthy spine. C-shaped curve, healthy joints and discs in between each segment, smooth edges around the bones, symmetrical, even curve. When we look at the importance of an x-ray, you can't take age or physique or any other variable under condition. Some people are born with spines abnormal. Others are developed through injury. I want to show you one where it was a born with condition, not anything that anybody was aware of. The x-ray on the right. What you'll notice here is that about 90% of her spine, except for one segment, is completely fused together. There is a disc space, so you can see a little black right there, a little black right there. This is a congenital, which means born with condition. And this is something that a traditional chiropractic adjustment with no x-rays, a perfect example would be the Great Clips of Chiropractic, the joint. This person ends up in that office, they're going to cause a lot of pain and irritation to the body. This spine right here needs to be adjusted very differently than the x-ray right here. Here's the problem, is that even within chiropractic, some offices, some corporate-based entities take a one-size-fit-all approach. When you take a one-size-fit approach and you do not individualize the standard of care for each person, or if you base the standard of care off of what the person is willing to participate in, then you create issues. When you have the need for x-rays, you take x-rays to find and determine where the subluxation pattern exists. You look at the mechanics, or what is controlled as biomechanics of the spine, and you focus on the integrity of the structure, which is the body and the bones themselves. If you do not focus on those elements, and you take x-rays as if you were in a medical setting, in an emergency room to rule out broken bones or to diagnose pathology or disease, you're going to miss a large part of this. And there's a growing movement in chiropractic not to take x-rays. There's governing bodies that say, why do you need x-rays if you don't think there's a broken bone? Well, this is a perfect example of why you need x-rays on an individual basis. You need to make sure you know where the spine is having injury at, if there are congenital anomalies, and how to appropriately adjust each and every person. There's an assortment of techniques. Some are manual, some are instrument-based, and those need to be utilized for each individual. If you are not having an x-ray on your spine and you're receiving chiropractic care, I would highly recommend modifying that approach and finding a doctor who will take the x-rays and correct your spine, taking post x-rays so that you can see above and beyond approach. Or, arguably, you can go ahead and take an x-ray at an office and see how well your chiropractor is doing when he doesn't have x-rays. Because until we have x-ray vision, you can't feel with your hands what you can see with your eyes. And you've got to see it in order to fix it.